I'd like to take you back in time just a little bit to January 1, 2020. We at that time received what I consider our first major gift for the project, and we crossed $1 million. And then March, we all know what happened. It was masking and isolation, Zoom calls, sadness, sickness, all of the things that engulfed all of us during the pandemic. Now, October through December, we were honestly giving it our all. It was a very difficult time for us at Bryan, treating anywhere between 150 and 175 COVID patients, which was more COVID patients than any hospital in Nebraska. But that brought us to March of 21. Great joy in our organization because we saw you all getting vaccinated and we were able to participate in that. And through it all, we now stand here today and we've secured, through your generosity, over $13 million for this project, which means the month that we established, about a year and a half, 2 years ago to start this project is going to be starting in the precise month on time. And we thank you forever for making this possible.
A lot has taken place in the planning of this center. We've conducted patient and community focus groups and gathered additional information and learned about that experience that people had when they were dealing with cancer. We engaged our tremendous medical staff. We engaged more of the community. We did site visits. We hired an architect that specialized in cancer centers because we know the people in this region deserve the best.
How do we make patient care better? How do we elevate the quality of care that's being given? How do we increase physician collaboration? Sometimes when you talk to people, you can sense their excitement. You can feel their energy. And as you're starting to kick around these ideas and that energy is flowing, and then it turns into, well, we could do this and we could do that. But it's in that very moment that you see it in their eyes. It clicks. See, there's a ripple effect that's happening. And it's going through the Bryan Health system, it's going through our community, it's going through greater Nebraska. And I will tell you, it is powerful.
We're going to include services in one building, such as infusion, clinic, radiation oncology, physical therapy, occupational therapy, survivorship, genetics, massage, med spa, PT, OT. The list actually goes on and on, but we're excited about all those services that we can actually put into the one building.
Our relationship with the Sampson family goes back much longer than that and much wider than just construction. They've been generous supporters of Bryan for decades. This most recent gift allows us to establish this as the Bryan South Campus with the Cancer Center as the anchor. And so it is with great honor and privilege that I get to announce to you tonight the new Cancer Center will be named the April Sampson Cancer Center.
Cancer tries to affect your daily life, and she tried to make it not affect her daily life. She didn't want anything special attention about it. So we expect to do the same thing here. We don't want any special attention for doing this. We just want to be part of the community. The fact that her name's on the building is a great tribute, but it's a great tribute only because she's one of the best people I was ever associated with in my life here. I've worked with Bryan Hospital personally for over 40 years, 4 decades. But working with him, I know this will be done right. That's the way that April would want it done, only do it right.